Climate change puts global health at risk. Extreme heat, hunger, and disease. Surge. Climate change is increasingly threatening global health, with rising temperatures intensifying food instability and the spread of infectious diseases. A study which includes data from 122 experts, including the World Health Organization, WHO, emphasizes the growing risks of climate change on human health. In 2023, the hottest year on record, the average person experienced 50 more days of extreme heat compared to previous years, further exposing vulnerable populations to health crises. Among the hardest hit groups are the elderly, with heat-related mortality among individuals over the age of 65 skyrocketing by 167% compared to the 1990s. Older adults are particularly vulnerable to heat-related health issues such as dehydration, heat stroke, and exacerbated chronic conditions. These statistics highlight the urgent need for targeted public health strategies to protect this population from the increasing frequency and intensity of heat waves, which are becoming more common as global temperatures rise. The impacts of climate change extend beyond heat waves, however. Droughts and floods have affected nearly 48% of the planet's land area, further exacerbating food insecurity and displacing millions. These extreme weather events, intensified by climate change, disrupt agricultural production, damage infrastructure, and lead to shortages of clean water, which disproportionately affect the most vulnerable communities. In 2023, it is estimated that around 151 million people were pushed into a state of food insecurity due to the combined effects of droughts and floods. This number underscores the profound and far-reaching effects of climate change on food systems and access to basic resources. Food insecurity not only jeopardizes the nutritional well-being of individuals, but also has broader consequences for global health. Malnutrition, weakened immune systems, and lack of access to clean water can lead to higher rates of infectious diseases. Furthermore, climate change also creates conditions conducive to the spread of vector-borne diseases such as malaria, dengue fever, and cholera, which are becoming more prevalent in areas where they were previously rare. As temperatures rise and rainfall patterns change, mosquitoes and other disease-carrying organisms are expanding their ranges, leading to more frequent outbreaks in regions with insufficient healthcare systems to cope with the increased burden. In addition to the health risks posed by extreme weather, the impacts of climate change are straining healthcare systems worldwide. Hospitals and healthcare infrastructure are struggling to cope with the increasing number of climate-related health issues, including heat stroke, respiratory illnesses, waterborne diseases, and injuries from extreme weather events. The growing demand for medical care exacerbates the strain on resources, especially in low-income countries that are already under-resourced. As the situation becomes increasingly dire, urgent action is required to mitigate the effects of climate change on health. Governments must prioritize climate resilience by implementing policies to reduce greenhouse gas emissions and strengthen infrastructure to withstand extreme weather events. Public health systems must also be better equipped to address the rising number of climate-related health emergencies and provide support to the most vulnerable populations. Ultimately, combating climate change is not just an environmental imperative, it is a public health necessity. By taking action now to reduce emissions, protect ecosystems, and build resilient healthcare systems, we can safeguard future generations from the devastating health impacts of a changing climate.